Ladies and gentlemen, when I first heard about anti-vaccination movement, it was in a sociology class in my final year of university. I was kind of shocked at the time because I didn't know vaccination could lead to autism. Actually, a paper published in 1998 indicated the correlation between vaccines and autism. The paper was widely criticized, of course, and it turned out the article was actually fraudulent and it was retracted later. But still, 1 in 4 parents believe vaccines can cause autism. Also, I didn't know in some places vaccination is not mandatory, including Japan, Pakistan, Australia, Madagascar, Britain, Ukraine, Italy, Nigeria, France, and the US. However, I do believe most people are still convinced by the effectiveness of vaccination and the importance of vaccination in promoting public health. So are most philanthropists, and that's why many of them fund research and development of vaccines. Vaccination development is a long and complex process, usually takes from 10 to 15 years, and it involves a combination of public and private involvement. The current system of developing, testing, and regulating vaccines, it was developed in the 20th century as the groups involved standardized their procedures and regulations. Vaccines are developed, tested, and regulated in a very similar manner to any other drugs. In general, vaccines are even more thoroughly tested than non-vaccine drugs because the number of human subjects in vaccine clinical trial is usually much more. Many philanthropists have funded the coronavirus research. For instance, the founder of Alibaba, Jack Ma, he promised more than $14 million in coronavirus vaccine research. The Bill and Melinda Gates Foundation has also pledged up to $100 million to the global response to COVID-19, and including funding to accelerate the development of vaccines. This is not the first time for the Gates Foundation to fund the development of vaccine. While philanthropists financed vaccine research long before COVID-19 came along. In 2006, the Bill and Melinda Gates Foundation announced 16 grants totaling $287 million to create an international network of collaborative research consortia focused on accelerating the pace of HIV vaccine development. Gavi, the world's leading international immunization nonprofit organization, also joined the Gates Foundation in push for a plan. Some people may wonder, AIDS has been around for maybe decades. Why haven't we developed a vaccine already? Well, apart from all of the challenges in medical research and development, today I want to talk about the challenges in funding and maybe in our society as well. To answer this question, we need to first look at the funding sources of vaccines. Well, indeed, philanthropists fund vaccines. We have talked about that. But most of the funding of a new vaccine comes from pharmaceutical companies and governments. Now, what the governments want? Of course, they want to safeguard the public health. They want to protect their people, and protecting the health is protecting the economy. So what the governments want is to protect their people's health. But which countries are most infected by AIDS? The least developed countries usually. And these countries probably don't even have a intact healthcare infrastructure to support their needs. So they have to look for help from nonprofit organizations and philanthropists. And for pharmaceutical companies, what do they want? They want to make profits. They're not charities, right? They want to make profits from new products. And if they want to develop an HIV vaccine, are they going to make profits? Probably not. Most of the infections are in the countries where infrastructure is not even in place to support people's daily needs. And those who are infected, they can't afford to be out of work. They need to make money for their basic needs. So, in the end, they can't have the money. They simply don't have the money to pay for an effective medicine or vaccination. The private companies are not charities, and they need to think about the cost, particularly in manufacturing and distribution. So these are the obstacles they are going to face in ensuring that any successful vaccine can be sold cheaply enough to benefit poor communities. Now we have talked about the governments and the pharmaceutical companies. And I think a lack of funds is an important obstacle in developing vaccines. And this is where philanthropists come in and back up very long-term research. Also, they bring together different groups of partners, such as universities, research labs, and other donors. One of the examples is open philanthropy. The foundation makes grants to vaccine research centers globally, such as a 2017 award, which is more than $11 million to support research for the development of a universal influenza vaccine. But developing the vaccines for the current pandemic is different. I think we have secured enough funds. After all, the success can have a social and economic impact, which is global. Virtually every country is plagued by the pandemic. Now let's look at some statistics. The American drugs group Johnson & Johnson is putting $1 billion into developing a specific coronavirus vaccine. And this project is jointly funded by the U.S. government. In the U.S. alone, the federal research centers have secured $1.8 billion in additional government funding for COVID-19 work, and the focus is vaccine investigation. I do sincerely hope we will come up with an effective prophylaxis in the near future. Thank you.